Hello and welcome to Sheffield Live. You are watching African Voices with me, Bailo Jallo, and my colleague, Chiwe Chihana. Hi, Chiwe.
Hello, Bailo. Good evening.
Good evening. Right, we've got a special guest here today, Susan Hurd from Public Health Sheffield. Hi, Susan. Can you introduce yourself more?
Hi, Bailo. Thank you. Yes, my name's Susan Hurd. I'm a consultant in public health and I work for the council. And my boss is Greg Fell, the Director of Public Health.
Right. Thank you very much for your time today. You are replacing Greg Fell here, as we wanted to have Greg Fell for this show regarding to COVID-19. Talk us through in terms of what has been happening since COVID-19 started. As we know, a lot has happened.
Yes, a lot has happened. So, so maybe perhaps if I sort of do a broad outline, I guess, of where we were at the start of the pandemic, with obviously increasing numbers of infections, and then we saw the NHS getting prepared for how many people might need to be admitted to hospital. The peak of hospital admissions was actually around about Easter time. And obviously that was during lockdown, so lockdown happened on the 23rd of March. And then since then, things have shifted a little bit into, so our hospital admissions are now very, very low and have been for quite a while. And deaths from COVID, I'm very pleased to be able to say we haven't actually had a death from COVID since the beginning of July in the city, which is fantastic. So a lot of the effort now has shifted to, well, how do we manage this on an ongoing, longer term basis? How do we manage to keep ourselves safe, keep our families safe, keep our communities safe, but also have a little bit of normality again, and get back to work and do some of the things that we used to enjoy before lockdown. So my work now really is predominantly around that, around working with colleagues across the city in lots of different organisations to help try to keep the infection rate or number of people with COVID as low as possible.
That's good news to hear, to know that the cases are going down, and yeah, that things have improved and it is continuing to improve. So over the past couple of months, what you guys have been doing in order to stop the virus from spreading, and as you've said, with regarding to the way things have improved and what people needs to do.
Yeah, so the sort of the key things really are around some of the things that were said right at the very start of the pandemic, which is, you know, if we really to try and keep cases a number of people being infected as low as possible, then the best thing we can do is some of the really basic prevention stuff. So people talk a lot about social distancing, and the safest thing is to be at least 2 meters away from other people, indoors or outdoors, if they're not members of your own household. Actually staying at home as much as you can is one of the key prevention things still. Though obviously people need to go to work and that's important. But if you can, where you can, stay at home as much as possible. Washing your hands lots with soap and water is still a really key prevention thing that we can do to keep ourselves safe. And obviously now we've also got a requirement to wear face coverings. If you can wear a face covering and aren't exempt for various reasons, then wearing that in enclosed public places. So that's the kind of really basic stuff that I think, I don't know about yourselves, but personally for me, I feel like some of those messages are not as clear as they were to begin with, because there's an awful lot of messaging coming out all the time, and it can be really hard to kind of make sense of a lot of the messages, because there's a lot, and I struggle with it to keep up with it. But those really basic things are still the things we need to do, and will be the things that we need to do for well, probably at least another 12 months. So I find that helpful because it simplifies it down to actually some more simple, manageable things that I can remember, particularly when the guidance keeps changing about what you are and aren't allowed to do. Yes, have I answered your question?
Yeah, I'm glad you said that. Chiwe, you wanted to come in?
Yeah, so thank you very much, Susan, for that update. I was just getting into the sort of the prevention management board strategy, which is coming from your office, and looking at community engagement, with Sheffield having quite a high percentage of people from Black, Asian, as well as other minority ethnic groups. There was quite a lot of delays in information being relayed in those communities. How has that changed with time, and what does the Director of Public Health Office look to do in future to engage better when the crisis like this arises?
Thanks. Yes, it's an ongoing piece of work, that really, and I think so I'll maybe tell you some of the things that we're doing, but we always need to improve, and things need to be better, and we need to be better and get better at reaching deep into the heart of different communities with messages. So there is an overarching, as you said, there's a prevention and management COVID board that's chaired by the leader of the council, Julie Dorr, and there are various representatives on that from community organisations, and including Black and minority ethnic communities. There's an overarching comms strategy that we've got for the city, and I think that's where there's a lot of work that's happened around getting messages out, and it's fantastic. For example, things like Greg's videos that you may have seen and some of your viewers may have seen, but we're very conscious that there are lots of people who won't be watching videos of the Director of Public Health. So how do we actually really use the right people to convey messages to different people in different communities across the city? So that's work in progress, really. We have made quite a lot of progress, I think, with knowing what the overarching strategy is, and then having working with organisations and community leaders within that, in terms of what are the clear messages we need to get out and how do we get them out. And I think there's an age thing in here as well, because one of the latest trends that we're seeing nationally is about a bit of an increase in cases in young people. So our communications need to reach young people as well as people of colour, or older people, or sort of different cohorts, different populations. So we've got that broad work, and there is a Black and minority ethnic network that's been running for the last 4 months. That's a joint piece of work between the Public Health Office and Black and minority ethnic communities and organisations across the city. So that's another mechanism for sharing messages and trying to get messages out. And then I'd say most recently, over the last 4 weeks or so, and you may have seen some things in the news around local testing sites. And we've got a local testing site now up and running in Sharrow, and we're trying to get some local testing sites also up and running in Darnall and Burngreave. So there's been quite a lot of work with local people, local organisations, local community leaders, as part of that, to again get messages out. Primarily, well, two things really. One, about the local testing site and the fact that it's there and people can access it if they have symptoms, and encouraging people to do that. But also, again, building on some of the sort of really basic messages about what you can do to help yourself, help your families, help your communities, to reduce the spread of infection. So there's a bunch of different stuff, I think, and it's all good stuff, but we need to do more, and we need to keep at it, and we need to hear from people what's working and what's not working. And if there are messages that aren't getting across or getting out, or if we're not doing it the right way, then we need to hear that, because we need to change what we're doing.
Speaking of what's working and what's not working, in terms of the strategy right now, especially with the local BAME communities, do you think the way you are raising awareness about COVID-19, it is getting to the right people at the right time? As you will know, Sheffield is a very diverse city where you've got so many communities, you know, and you mentioned about Burngreave and Darnall wanting to put some local testing areas. How are you making sure those strategies or those plans that you are having is reaching to the right people, or to the people that really needs it?
Yes, and it's a great question, because it's a tricky one to know whether you're really reaching people, because if there will be some people who come back and say, well, we've heard the message, and therefore you've reached them, but then if you haven't reached somebody, then it's difficult to know, isn't it? So, I mean, I think the crucial thing for me is about that we're talking to local organisations, local leaders, local people about what would work and what won't work, and actually who does the message giver need to be. So the council comms team and others will put out lots of messages. That's great, but we know that there are people who won't read those messages. They're not engaged with those kinds of platforms or whatever. So really it's about working with communities and working with local people to really understand what is going to work and how do we do it and who's best placed. So it's an iterative thing, I think, really, and it's an evolving thing. And for me personally, I think it's something that, I think it's crucial actually to communications is one of the biggest things that we need to keep on with over the next 12, 18 months. But making sure that we listen to people about how best to convey the messages and who's best to convey the messages is something that we just need to keep doing.
Thank you, Susan. Two questions that you could probably take in one response. So the first one is, how have the statistics at the height of the pandemic? We had quite a high number of infections within the Black population. I wondered, I know the general picture for Sheffield is that statistics have really dropped drastically, which is really good. But how is that looking like now within the Black community? And then the second question is about the public question sessions that in order to help with prevention strategies. How does that information get out? I've seen it on your website to say that that's available to the public, but that's the first time I saw it. Is there any other way people can engage?
Okay, so the first question, so what are the stats doing? So the statistics in terms of infection numbers, so we're in Sheffield, Greg describes it as stubbornly, persistently, slightly higher than we'd like. So our rates of infection so this is publicly available information around what the rates are like in places like Bradford and Blackburn with Darwin and places in Greater Manchester. So their rates are far higher than ours. We're sort of bobbing along around the perhaps 14, 15 cases per 100,000 population. So that's the incidence rate, which is a bit higher than we'd like, but it's not high enough to then get us into a situation where national government are looking to intervene. In terms of infections and how it's affecting the Black population, we can see, so ethnicity is recorded and ethnicity is improving in terms of the recording in the data that we see. So at the start of the pandemic, actually back in March, we were seeing higher rates of infection in more affluent populations and more white. And then now things are changing a bit. We are seeing, certainly a month ago, we were seeing proportionately more infections in the Black minority ethnic population compared to the proportion that live in the city. And actually that's a consequence of people in key worker posts who can't work from home, who are out working in the city, providing all the essential services that we need. So then you're more exposed to picking up the infection. So we know that's a consequence of that. I would say there's been a bit of a shift just in the last week or so to 10 days, where we're seeing a slight decrease in the proportion in the Black minority ethnic population and a proportionate slight increase in the white population and younger people again. So I think it's an interesting one in that it's about the evolving nature of a pandemic, I suppose, is that it's going to change in terms of who's most affected at various points. And I guess the bottom line for me is we're all at risk, and we can all do things to protect ourselves and our families, and it's some of the basic stuff I mentioned already. So I think it's really important that we recognise, that that none of us in any community can afford to be complacent about this, because we're all at risk.
Yeah, but then there's the aspect of their public. You've set up a public questions on a monthly basis that people can get to. So the second part of that to me was really crucially to respond to access for those communities, so that that information, especially if we're thinking a second wave is going to be happening, which I hope is not. Yeah, it's just getting more targeted as well, so that those people are part of the conversations that you're having.
So apologies, because I'm not quite sure what you're referring to, and I'd rather say I'm not quite sure rather than give you an answer that bluffs around it. I'm not sure if if you mean the Race Equality Commission, or if it's to do with the prevention and management board.
COVID-19 public questions. So that's open to the public on a monthly basis via Zoom.
Right. Okay. So apologies, because I don't know is the honest answer, and obviously that's a really important piece of information for your viewers. So hopefully we can get that to you.
No problem. Thank you very much, sir. Yeah.
Yeah. Susan, you kind of you highlighted Bradford as an example, and there was a time here just a couple of weeks ago where West Yorkshire, or the Yorkshire region, the North in general, where we were at risk of a local lockdown again. And that came very close to areas like Rotherham, Barnsley, but then it shifted. And in terms of Sheffield, which is bigger than Rotherham and Barnsley, right now, as you mentioned there, the figures are somewhere where it is low, but not to where we want them to be. So is there a risk of a local lockdown, or we are safe?
That's the $1 million question, isn't it? So right now we're not at risk of lockdown, but it depends on what happens. So it comes back to, I mean, I think it's that thing about not being complacent. And I would say a few weeks ago, so it's interesting, national government are getting clearer themselves around when they might want to intervene and what data they look at to make a decision. So the numbers of infections is one piece of information they look at, and we also look at how quickly is that changing. So I think Oldham, for example, had a very rapid increase in cases, and there's other bits of information we look at to sort of look at it in the round. So it's one of those things where we're absolutely not at risk as the numbers stand today. But maybe in a month's time, if our numbers have crept up and we can't explain why, then lockdown's too strong. I mean, I don't think, it's that kind of degrees, isn't it? It's a little bit of reversal of some of the easing. So you might not be able to visit people in their own house if they're not your household, for example. I think we're a very long way off where we were on the 23rd of March, a very long way off that, and hopefully we will stay nationally, as well as Sheffield, very far away from that. But it comes back to those basic things again around, we will stay away from that if people keep with social distancing, if people keep on with washing their hands and doing all the things that we need people to do. And lots of people are. We have lots of great information that the vast majority of people are doing all this, and they're trying really hard and they're working really hard at doing all these really important prevention measures. So thank you to everybody who is, and please carry on, because that's what will keep us out of being in any kind of lockdown situation.
Okay, that's good to know. I just wanted to squeeze in one question quickly, because as I can see, we are nearly time for you to leave. You mentioned earlier about the relationship right now with the BAME community, how you are working together. Excuse me. We know during the height of the pandemic, there was outcry from the BAME community that they were being ignored by Sheffield City Council and other organizations in general in Sheffield, and there was no support given to them. So right now, in terms of the relationship between Public Health Sheffield and Sheffield City Council and the BAME community, how will you describe that relationship? Will you say right now that relationship is where it is needed to be? And can you admit that there were failures at the beginning?
So I think, I think it's a work in progress again. And I know I was just talking earlier talking to people earlier in a meeting before I came in here about the work of the BAME network over the last few months, and the feeling that people are starting to feel heard and valued in a way that they haven't perhaps been before, or felt that way before. So that's really positive. I think it's ongoing, and there's work to do to continue that. You know, I mean, speaking in a public health personal capacity around that bit of your question, was it as good as it should have been at the start? I think probably all of us would say it's not been as good as it should have been with any communities. But that's the nature of a new disease that none of us have ever encountered before. And there's a lot of learning as we go. So the things that we know now compared to what we knew even 3 months ago, you know, I look back at some things and think, gosh, well, I now know this, so I might have done that differently back then. So I think what's really clear for me is the importance of clear messaging and the importance of consistent messaging, and just sort of making sure that as much as we can that's what we're doing. So yeah, so I think we're on a journey, and I think we need to keep on it really, and get us to where we want to be.
QA, final word from you.
Thank you so much for joining us, and also on the progress that's being made. I imagine there'll be new challenges coming up, but yes, I think the community, in our viewers would definitely like that communication to keep growing and improving. So thank you for coming on the show as well. This is part of the engagement that we're looking for. Welcome back to African Voices platform. So we've now been joined by my colleague Enoch Karimba. Bailo and I have just been speaking to an official from the Director of Public Health Office, one of the public health consultants there, Susan Hurd. We want to have a bit of a reflection on what happened today. So I'll probably just give a bit of insight into what my initial thoughts since that conversation. Bailo, shall I just go ahead with that, and just maybe you could come in as well as I give some thoughts on that?
Yeah, sure.
Mm-hmm. So I thought it was good that we got an opportunity to engage with the Director of Public Health Office, because they're leading on the strategy, especially in terms of the prevention work that they're doing in the event of a second wave, but also just preventing and lowering the statistics. It was good to get insight on that the numbers have reduced, and getting a feel of it from what it was like in April to where we presently are. A big thing to take away is the acknowledgement that the number of people who were being infected from the Black community were primarily those from the health community themselves, health workers. Do you want to pick up on anything there? Or Enoch, if you've got a question for us with regards to that.
Yeah, sure. That was one thing that she just mentioned that she spoke about, which for me personally, I was not aware of. So it was kind of news to me. But one other thing I picked up as well was the fact that they've kind of now introduced testing centers in some of the areas where the BAME community is a majority in those areas, or there is a high number of BAME communities. She mentioned places like Sharrow, where there is now a testing center where people can come in easily without booking an appointment to just come and have a test. And also she mentioned that in Bongrave, which has got a very high number of ethnic minorities or a very diverse area, there will be a test center there very soon as well. And she also mentioned areas like Darnall, which has also got a very high number of ethnic minorities. And the fact that as well, she mentioned at the beginning of the pandemic, most of the people that were kind of getting COVID-19 or that tested positive to COVID-19 were more of like the white community, but later was, or at where we are right now, the BAME communities or the Black and ethnic minority communities as well are kind of we are getting more positive cases in the BAME communities, which as well, she highlighted the fact that most of them or some of them work in frontline roles and that kind of thing, you know. Enoch, I don't know if there was any other question that you're thinking of kind of asking us.
Yeah, thank you. Basically, having mentioned some of those postcodes, you know, or the areas like Sharrow, Dano, I'm thinking of other areas in Sheffield. I don't know whether, you know, these did come up in the conversation, but there are some small pockets of BAME communities within other postcodes, which I know that deprived areas. So I'm just wanting to know what was the criteria for them, you know, other than knowing that those areas are predominantly BAME communities, but also there are some other areas in Sheffield which are predominantly white but run down and vulnerable people live there, as well as other BAME communities within those areas. Did she mention a rollout of this testing to other areas rather than the BAME areas that you just mentioned?
Thanks. A very good question to ask, Enoch. So our focus was definitely on primarily BAME conversations, BAME communities, because we wanted to use this as an information platform for our regular readers. What she did point to was the fact that there was no complacency in any of the given situations in terms of what's being rolled out as far as prevention is concerned, testing. So it may well be that those areas are already covered, but because we had a very specific niche question that we were asking about diverse communities, she responded in that way. But also, I think in terms of her department, the Directorate of Public Health, they're very clear that they want to be able to not be complacent in the sense that they're using strategies that cover the entire communities, because it keeps changing which demographic is mostly affected. So like Abailo mentioned, at the beginning of the crisis here in Sheffield specifically, it was primarily the affluent communities and which were predominantly white, and then that changed, and then to sort of more the Black and Asian communities. And currently, the numbers that are rising that they've seen in Sheffield is young people. So I guess that conscientization, of course, has got to be around all the demographics, but we have, on our part, I think it's important that we start delivering messages like this one, that look, your young people are also starting to get infected. Can we make sure that they're taking necessary precautions as well? That's very important to me.
Okay. Also, did she mention any methods of communication, towards the BAME areas? Because I'm not sure whether, the council has any communication method to reach out to people that might not be aware that the areas, there might be testing taking place. So has there been any measures that have been put on ground for people to be notified?
Well, in terms of that, I asked a similar question, not of the exact of what you've asked, but I did ask what was taken, or what are the strategies that have been taken to raise more awareness in the Black community or in the BAME communities to make sure that information is reaching to the right people at the right time, which she kind of acknowledged that they've been working with community leaders from various areas, and those leaders have been trying some of the information that the council or public health is sending. Those community leaders are kind of helping to send the message out to the local communities, but she also acknowledged that there is room for improvement. And in terms of that, they're working hard in order to improve things. But one thing which all of us know, COVID-19 came at a time when nobody was expecting it. It is a new disease that came out. So things were not as perfect as they should be, but they're looking forward to kind of like putting things right. And I also asked about the relationship with the BAME community, because at the beginning, as we all know, the relationship in terms of the BAME community was not good. But she also said in terms of that, there was no community that was perfect, and the relationship with all the communities needed improvement, and which they're working hard towards improving it. But right now, the good news is they're working together with BAME communities and community leaders in order to raise more awareness and to kind of tackle some of the challenges. I don't know, Chiwe, if you want to add anything on that as well.
I actually found that a little bit hard to swallow when she said, well, yeah, it's not just the Black and Asian communities that we had a fraught relationship with, and that in each case, every one of them, I mean, we're very specific. I think the messaging has been very clear, and the research has shown that actually a lot of the BAME communities, whether by neighborhoods or by issues that impact BAME communities more, the Sheffield City Council itself in its entirety and other big institutions in this country were far detached. They were not responsive to the community's needs. So at that point, I just didn't get a chance to, but I would really want to say, I think that that to suggest that the engagement of Sheffield City Council with the BAME community was the same as that of the white community is untrue.
Okay, because I'm looking at some some areas of concern here. You know, we all know, you know, COVID-19 is most prevalent within the BAME community, but also there are underlying issues that, if tackled or if managed well by the council, these spreads of COVID-19 won't be really so high as being projected by the media and the government. So I'm just thinking, will there be a certain working relationship or an improved relationship as a lesson being learned from COVID-19, the way you know, the council or the local authorities are trying to do? I mean, if you look at, they all said housing is always an issue within the BAME community, you know, overcrowding, as well as, you know, a lack of opportunities, health and well-being, mental health and everything else. COVID-19 is only, you know, a snapshot of what's just of a bigger issue, you know. So if this issue, to me, I think the council should look at the bigger picture, not just COVID-19. I understand, you know, it's a big pandemic, it's affecting everyone else. But if you look at the other underlying issues that have been around for a long time, that council should have managed or should have tried at least to tackle, you know, the prevention in some of these areas that we're talking about. You know, those are failures to me that I can see the council has failed, not only the relationship with the BAME community, but also the systematic, you know, failures that have been, you know, played around by the council. I don't know if you guys, you know, saw this or the way I see it, I don't know.
That's a good point there you've highlighted, but one thing I want to make clear here is like, one thing we need to know, Susan is not a politician. She came from public health, Sheffield. And also we didn't have that much time because it was only just for 20 minutes. Some of those questions that you are raising now, you know, we could have had time to ask that, but we didn't have much time. As you know, the show is always for like an hour. And out of the hour, the reason why we are reflecting here right now is because we didn't have the full hour with her. We just had 20 minutes. Yeah, but those are questions that remains to be answered or that needs to be answered. So hopefully maybe in the future, we can get someone from Sheffield City Council to see what they will say to that. I don't know what you think, Chiwe.
Yeah, no, I definitely think we were limited by time, but also her remit is very limited because she is very specifically a consultant within the Public Health Directorate. So I would give her, I would say she would probably not have been able to answer some of these more complex. They're more of a strategy-based, Sheffield City Council strategy for engagement-based questions. So, but yeah, it's important to raise those issues. However, looking at time now, I'm going to have to say we need to end the show. And thanks so much, guys, for the reflections. Just one last comment by Lo and Enoch, and then I'll close off.
Yeah, I think you guys, we did well, but also understanding that the lessons learned from this should be a reflection, you know, not only to Sheffield, but across South Yorkshire and beyond. That's what I can say.
Yeah, for me here, all I can say now, her being on the show has shed more light, because in terms of this, just giving us some of the recent figures around Sheffield. Yes, they're not good figures that we want right now, but it is lower than to where it was before. And we also know now that young people are kind of getting the virus. So one thing I would just like to say now is for young people to be careful, everyone to be careful, but especially young people as well, because right now they are getting the virus. And she mentioned about the face mask and everything. So I will encourage people to kind of respect the guidelines that have been given out there by the government or public health, and also to keep up to date with what is happening in their local areas or in their neighborhoods.
Thank you very much, Bailo and Enoch. That's very handy to have. Also, just to remind the general public that as we were speaking to Susan Hurd, who is from the Directorate of Public Health Office, we also discussed the monthly meetings that the board looking at prevention and management of COVID-19 hold. This is a public meeting that that you should be attending, so you can ask your questions, get your answers, and see how you as a community can be part and parcel of the healing process of through COVID-19. Join us again next week for a dedicated show to COVID-19. Thank you, Enoch, and thank you, Bailo. Good night, African Voices viewers.